Hello, welcome to our frequently asked questions, and today I'm answering a question about blepharoplasty. What is the recovery time after lower blepharoplasty? Well, when we consider this, there are several elements to answering this question. The first is, what time do I need off social, professional kind of commitments? What time do I need off work? Secondly, and more specific things like how much time do I need off exercise, wearing of contact lenses, and other specific circumstances. And thirdly, what can be done to enhance recovery? Well, these can be measures during the surgery, these can be measures that are taken before the surgery, and there are measures that you can personally take after the surgery to enhance recovery. My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon. And blepharoplasty is a procedure that I help with patients every single day. And the information that I'm discussing with you today is information that I discuss with my patients on a frequent basis. So in terms of the recovery, after lower blepharoplasty, in terms of social and professional commitments, I would advise you having a 2-week period off work to enable this. And the main things with recovery after lower blepharoplasty are swelling and occasionally bruising. And swelling is a normal part of healing, and generally 80 to 90% of the swelling will go in the first 2 weeks after surgery. And bruising, from personal experience, most of my patients don't have much bruising after lower blepharoplasty, but there is always a possibility with any eyelid procedure. And most bruising will go within a 2-week period. However, there's always a small chance of more resistant bruising that can take even up to 6 weeks to fully dissolve. So in terms of bruising, you can wear camouflage makeup that will cover this bruising even a week after the surgery to make it more discreet. So in terms of normal healing and time off work, generally I'd recommend you have a 2-week period after lower blepharoplasty. Now, other considerations are, in terms of exercise, I'd recommend having 3 weeks off aerobic exercise, and that includes running, yoga, most common activities, and this just gives time for the eyelid to heal. And your eyelid has very fine anatomy, and healing in this area, although fast, isn't instantaneous. And if you do more activity soon after surgery within that 3 weeks, you're going to increase the chances of swelling and increase your recovery overall. So I would invest a 3-week period where you hold off that kind of activity. Having said that, things like walking, that is absolutely fine, even within that 3-week period. Now, other things such as contact lens wear, I'd recommend having 2 weeks off wearing contact lenses. In terms of important social events, and this might be weddings or other events where there'll be a lot of HD cameras or close friends or family, I would generally recommend you really have 6 weeks between having surgery and that important event, and that really gives you a good time to recover after the surgery, and a lot of the symptoms and signs will have resolved at that point. Now, in terms of measures that can be taken to enhance healing, during the surgery there are measures that can be taken to give you a faster healing. Lower blepharoplasty is a procedure that really can be performed in 2 principal ways. And the more conventional way of doing the surgery is surgery through the skin, and this does involve a scar in the lower eyelid. And I personally don't advocate using this technique. However, traditionally this is how a lower blepharoplasty was performed. This technique does give you a longer degree of recovery because there is a scar that is in a relatively visible place, and there can be subtle changes in the shape of the eyelid. A more modern way of performing the surgery is called Trans-Conjunctival or hidden incision technique. This is certainly my preferred method of doing lower blepharoplasty, as it avoids a scar and hides the scar on the inside of the eyelid. And with this technique, recovery is certainly enhanced because there is no visible scar even the day after the surgery. So recovery is different depending on the technique that is used. Trans-Conjunctival with a hidden scar technique, looks good even a week after the surgery. Using the more conventional Trans-Cutaneous technique, the scar is more visible and it takes some weeks for that scar to become more camouflaged. So what other measures can be taken to enhance healing after lower blepharoplasty? Well, certain techniques such as the use of platelet-rich plasma, which is your own growth factors, when this is used in conjunction with certain procedures in lower blepharoplasty, this can enhance recovery. Now, in terms of before surgery, well, there are instructions that I give to all my patients for certain medicines, herbal medicines that are best avoided before surgery, as these can thin your blood and give you an increased chance of bruising or swelling after surgery. So, for example, fish oils are a good example of this. Well, they're best avoided for 2 weeks before and after surgery, as this potentially could give you more recovery if they're not stopped. After the surgery, well, there are certain things that you can personally do to enhance recovery. Some of these include using the ice or cold compress around the eyelids. While using this in the first 3 days, this will enhance recovery by helping to reduce swelling. In addition, there are measures that can be taken with the use of herbal medicines and anti-inflammatory medicines, and I give all my patients a prescription for medicines which will enhance recovery by reducing swelling over this time frame. So in summary, lower blepharoplasty, well, it's a procedure that does have some recovery after surgery, but generally speaking, recovery is fairly fast, and most patients need up to 2 weeks in terms of looking normal and being able to attend normal professional social events. We've also talked about specific circumstances such as exercise, measures that you can take both before, during, and after surgery that will enhance recovery. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.